Dr. Sherry Berger from VetVine here this week. Pleased to be welcoming a colleague who's joining us from the University of California at Davis, Veterinary Teaching Hospital, Dr. Melissa Bain. Dr. Bain, welcome.
Thank you very much.
So pleased that you can join us today.
Owners in exam rooms in which music was playing actually rated their experience better than if they didn't have music playing. It is more so related to how satisfied were you with the time spent. And since it's a teaching hospital, they can be quite lengthy time that they're waiting in an exam room for a student to come in, take the history, step out, talk with the clinician, come back in with the clinician. It's all very well done, but it does still take time. And owners that were in exam rooms where music was playing actually reported themselves to be more satisfied with the time spent in the exam rooms. The other finding that didn't have anything really to do with the music, but had to do with other aspects of veterinary care was owners rated their dog's anxiety level in the waiting room much greater than their anxiety level in the exam room. And what that can tell us in veterinary practice is get the dogs out of the waiting room as quickly as possible and into an exam room. So it's small things that can make a big difference. And we also asked the clinicians, there was 3 clinicians at the time, and we asked them to rate each individual dog's anxiety and aggression level. And there was a difference between the rating levels between the owner's observations and the clinician's observation. And the owners were more likely to rate their dogs as higher in anxiety and aggression than a clinician were to. So there's a lot of things that veterinary practices can do to help increase the comfort level of their patients, and certainly increase the comfort level of their clients as well. And easy and inexpensive things, something like I already mentioned, getting the animals into the exam room quicker and not having them wait out in the waiting room. Can we have a separate cat area where owners with cats can wait, separate from the dogs? Can we put the cats up on little shelving units so that if a dog were to walk by and it won't be able to stick its nose into the carrier? Can we cover each cat carrier with a towel that's sprayed with feel-away as soon as they walk in the door? Can we change the mood lighting in the waiting room? Can we have a fountain? Can we have a coffee maker or a Keurig maker or cookies for humans? Just to make people happier, to be there, a little less stressful, have updated magazines, things that make people, happy. Like when we go to dentist office or doctor's office, what do we want to see there? We don't want to see big fluorescent banks of lights and loud noises and smells like cleaner. And if we're acknowledging these things, the animals certainly are going to be acknowledging these things as well.
Well, yeah, and I was going to remark, a lot of our animals pick up on our vibes or the energy that we put out. And I wonder how much of that plays into your paper. Did you think about those kinds of things? Any correlation between how the owners, for example, rated their visits and the scores that the dogs got?
We didn't look at that. So that would be something, if they were more comfortable or happier, do they rate their pet's experience better? And it's going to be always hard to tease that out. And then we look at, other things in exam rooms when owners are more comfortable in the examination rooms with their animals. Do they feel heard? Do they feel like the veterinarian's listening to them? And is the veterinarian taking time with their pet and not rushing through the procedure? The animal certainly is going to feel better because it's going to be handled in a lowest stress way possible. And the owners are going to be happier because they're going to see the care that the veterinarians are giving. So it's all interrelated. And frankly, I don't think we need to separate it out because it's how we should practice.
Right. And in our last update, we talked about, why is it that sometimes we say things to clients and they don't seem to hear it? And part of it could be due to the fact that they are anxious and they are upset and maybe not comfortable. And so their brains are not tuned into listening and or absorbing.
Oh, absolutely. When we're stressed, our veterinary students here at UC Davis go through a 4-year-long communications course, and they have simulated client experiences in which they have difficult conversations, money, angry clients, disgruntled clients, clients with a backstory, all these things, and educating veterinary students and veterinarians on checking in with the client and seeing where they're at and whether they're stressed about the diagnosis you just delivered or the stress level that their pet is facing at that moment because he's uncomfortable or aggressive at the vet clinic. All of that plays a role into what clients are going to be hearing. What the paper obviously is focusing on the music, and that's all we looked at in this paper, but it's going to be beyond the music. And music it's easy, it's inexpensive, and it does no harm. We know it won't hurt. And if we can expand it, we just played it in the exam rooms. We didn't play it out in the waiting room area. But is this something that can then translate to in the treatment area? And I know when I was in general practice, we played rock music and pop music and dance music, and we shouldn't. Perhaps it's when we're looking at playing classical music in the back area, in the treatment area and surgery areas. One study I did reference in here was a study looking at cats under anesthesia. So under anesthesia for being spayed, and they reacted differently to different types of music. So while we think they're asleep, they're actually responding to ambient noise.
So, are there any specific classical tunes you would recommend to play or to avoid?
The quiet ones, no 1812 overture, things like that. So, certainly clients are going to be purchasing the Through a Dog's Ear. And while we don't discourage that by any means, the original songs that we played that were the same songs as the Through a Dog's Ear would be a good starting point. Or, the Through a Dog's Ear certainly would be something we could recommend as well.
I really appreciate you taking the time to talk to us about this today, and thank you.
Well, thank you very much for having me.